Health Canada authorized this vaccine as a 2-dose primary series administered 4 weeks apart. It's a smaller dose of 25 micrograms, which is half the dose authorized for children 6 to 11 years of age, and 1/4 of the dose authorized for people over the age of 12. The clinical trial showed that the immune response to Spikevax in children 6 months to 5 years of age was similar to that seen in people 18 to 25. And the clinical trials were conducted when Omicron was the predominant variant circulated in Canada and the United States. Efficacy estimates among participants 6 months to 5 years of age are similar to those in adults during the Omicron wave. As with all clinical trials, the children in the study were followed closely for any reports of side effects. And the vaccine was well tolerated, with no unexpected safety issues identified. The most frequently reported adverse reactions were irritability or crying, pain at the injection site, sleepiness, loss of appetite, and fatigue. The reactions were usually mild to moderate, resolving within a few days of vaccination, and no serious adverse reactions were reported. As with all authorized COVID-19 vaccines, Health Canada has issued terms and conditions to the manufacturer, requiring them to closely monitor any emerging safety issues, including any cases of myocarditis and pericarditis. Health Canada and the Public Health Agency of Canada will continue to work with provinces and territories, the manufacturer, and regulators around the world to monitor the safety of the vaccine. And we know that this collaboration has been able to quickly identify even the very rare and unexpected side effects that we've seen. This authorization comes at a critical time in the pandemic as we progress through the 7th wave. And though children are less likely to experience complications from COVID-19, they can still get very sick. And children, like adults, can spread the virus. Emerging data also suggests that children with COVID-19, regardless of severity, can develop long COVID. And rarely, some go on to develop multi-system inflammatory syndrome in children, which has a very high risk of hospitalization. There have been many questions over the last few weeks as well about new vaccines targeting the Omicron variant. Health Canada received a submission on June 30th from Moderna for its bivalent vaccine targeting both the original strain of the virus and the Omicron BA.1 strain for use as a booster in people 12 years of age and older. In addition, Moderna has indicated it plans to study a booster dose for children under 6 years of age, targeting the Omicron variant and the original strain of the virus. Other manufacturers have also indicated that they plan to make submissions for bivalent boosters for adults in the coming months. However, it may take some time before they make submissions for younger children. And vaccine manufacturers typically first conduct trials in adults and adolescents and then extend the studies to younger age groups, and this takes time. It's still important to remember in the meantime that the vaccines used in Canada are very effective at preventing severe illness, hospitalization, and death from all strains of COVID-19, and are the best tool we have available to protect ourselves, our families, and our friends. Now that the vaccine is authorized, I'm sure everyone is anxious to hear how it'll be used, and Dr. New will be providing an update shortly. Thank you. Merci. Miigwech.
Bonjour, merci de vous joindre à nous.
Hello, thank you for joining us. I'd like to talk to you about Spikevax, Moderna's vaccine, and its use for children after 6 years of age. 1.7 million children in Canada are now eligible for this vaccination. Health Canada heard Moderna's presentation with respect to children of 6 months to 5. These are data from the clinic for children and those older, and this because of the millions of doses given in the world. There will be a primary series of Moderna Spikevax, which can be offered at 6 weeks of interval, 50 milligrams for children from 6 to 11 years of age. It seems that the immune response of children to this Spikevax was similar to those observed in people of 18 to 25. Clinical trials were performed while there was another variant in Canada. The efficacy for those 6 months to 5 years were during the Omicron wave. As for all clinical trials, children took part taking part, rather, were closely followed in order to note any secondary effects. There were no major side effects. For the most part, there was irritability, crying, pain at the injection site, sleepiness, loss of appetite, and fatigue. Reactions were mild to moderate and disappeared a few days after the vaccination. No serious undesirable side effect was noted. Health Canada has told the manufacturer to closely follow any possible problems, including myocarditis. Health Canada and the Public Health Agency of Canada are working with provinces and territories and manufacturers and regulatory organizations worldwide to make sure that this vaccine is safe, because we want to be aware of even rare and unexpected side effects. We are at the beginning of a seventh wave, and children aren't likely to develop bad cases of COVID, but they can still be contagious and propagate the virus. People who get COVID, even if it's not, even if they don't have serious symptoms, they can still get long COVID and are therefore associated with a greater risk of hospitalization. There are new vaccines targeting COVID. There was a presentation by Moderna of a vaccine that targets the stem cells of this illness. Moderna also said that they want to study the administration of this vaccine and also discuss booster doses. They said that they intend to give a presentation on the bivalent dose. The first trials were on adults and younger people, but now it's going to be done with young children. Vaccines given in Canada are very effective in preventing serious cases, hospitalization, and deaths, and this for all variants. Vaccination remains the best way to protect our families and our loved ones. Now that the vaccine is here, I'm sure you'll be interested to know more about how it will be used. Dr. New will now give an update. Thank you.
Merci, Dr. Berthiaume.
Thank you. Thank you, Dr. Berthiaume. I'd like to say hello to all.
Response to the COVID-19 pandemic, and it remains one of the most effective ways to protect against serious illness, hospitalization, and death from COVID-19. Given that some provinces have entered a summer wave, today's announcement on the authorization of a vaccine for children under 5 years of age is welcome news. A COVID-19 vaccine to protect young children has been long anticipated by many parents in Canada. Today's announcement provides parents and caregivers with a vaccine option to protect younger children in their care against COVID-19. The National Advisory Committee on Immunization, or NACI, has carefully reviewed the available evidence on the safety, efficacy, and immune response generated by the Moderna Spikevax COVID-19 vaccine, as well as the spread and severity of COVID-19 in children under the age of 5. NACI is recommending that a complete 2-dose primary series of the Moderna Spikevax COVID-19 vaccine may be offered to children aged 6 months to 5 years who do not have contraindications to the vaccine. NACI recommends at least 8 weeks between the first and second dose. For children 6 months to 5 years of age who are moderately or severely immunocompromised, NACI recommends that a primary series of 3 doses may be offered with an interval of 4 to 8 weeks between each dose. This is because people who are immunocompromised may have a lower immune response to COVID-19 vaccination. Infectious diseases like COVID-19 are unpredictable. Although younger children are less likely to get very ill from COVID-19, some can get really sick, including previously healthy children. Since Omicron became the dominant variant, more children have become infected, and the number of hospitalizations and ICU admissions of children under 5 years of age with COVID-19 has increased. COVID-19 vaccination in younger children will increase their protection against severe illness. Even if a child has been previously infected with COVID-19, vaccination is still important. While infection alone provides some protection, vaccination helps improve the immune response and can provide stronger and longer-lasting protection. For children under 5 years of age who have already had COVID-19, NACI suggests waiting 8 weeks after the start of COVID-19 symptoms or a positive COVID-19 test before beginning or continuing the primary series. This interval may be shortened to 4 weeks for children who are moderately to severely immunocompromised. At this time, NACI recommends that children 6 months to 5 years of age receive this vaccine 14 days before or after receiving a non-COVID-19 vaccine. This precaution will help determine if a side effect that may arise following immunization is due to the COVID-19 vaccine or a non-COVID-19 vaccine. There may be circumstances when it is necessary for a dose of this vaccine to be given at the same time as another vaccine, in which case a healthcare provider can help with decision making. Based on provincial and territorial projections, there will be sufficient supply of the Moderna Spikevax vaccine for children 6 months to 5 years of age. The Government of Canada is working closely with provincial and territorial partners and understands they will be rolling out vaccination programs for children in this age group shortly. Please check your provincial, territorial, or local health authority website for information on when the vaccine will be available in your area. Starting a primary series now will provide some protection to these young children. It is also an opportune time to remind everyone to stay up to date with COVID-19 vaccines and the boosters recommended for them. While this authorization and NACI recommendations will come as a relief to many parents of young children, some may still have questions about vaccination. Parents and caregivers should speak with a trusted healthcare provider if they have questions. Information is also available on your federal, provincial, territorial, or local public health authorities' website. Thank you. Merci. Miigwech. Bonjour à toutes et à tous. La vaccination est...
Hello, everyone. Vaccination is a very important tool in dealing with COVID-19, and it remains one of the most effective ways to protect against serious illness, hospitalization, and death from COVID-19. Given that some provinces have entered a summer wave, today's announcement on the authorization of a vaccine for children under 5 years of age is welcome news. A vaccination against COVID-19 to protect children has been hoped for a long time by many parents in Canada. Today's announcement will offer parents and caregivers a vaccine option to protect children against COVID-19. The National Advisory Committee on Immunization, NACI, has carefully reviewed the available evidence on the safety, efficacy, and immune response generated by the Moderna Spikevax COVID-19 vaccine, as well as the spread and severity of COVID-19 in children under the age of 5. NACI is recommending that a complete 2-dose primary series of Moderna Spikevax COVID-19 vaccine may be offered to children aged 6 months to 5 years who do not have contraindications to the vaccine. It also recommends that at least 8 weeks be allowed between the first and second dose. For children from 6 months to 5 years of age who are mildly to severely immunodepressed, NACI recommends a primary series of 3 doses with an interval of 4 to 8 weeks between each dose, since immunodepressed persons may have a weaker immune response. Infectious diseases like COVID-19 are unpredictable. Although younger children are less likely to get very ill from COVID-19, some can get really sick, including previously healthy children. Since Omicron became the dominant variant, more children have been infected, and the number of hospitalizations and ICU admissions of children under 5 years of age with COVID-19 has increased. COVID-19 vaccination in younger children will increase their protection against severe illness. Even if a child has already contracted COVID-19, vaccination is still important. Even if a preceding infection offers a certain protection, vaccination improves the immune response and can offer stronger, longer-lasting protection. For children under 5 years of age who have already had COVID-19, NACI suggests waiting 8 weeks after the start of COVID-19 symptoms or a positive COVID-19 test before beginning or continuing the primary series. This interval may be shortened to 4 weeks for children who are moderately to severely immunocompromised. For the moment, NACI recommends that children from 6 months to 5 years of age get a vaccine 14 days before or after having had a vaccine against COVID-19. This precaution will allow us to make sure that if there is a side effect that happens after the vaccination, it will be because of the COVID-19 vaccine. In some circumstances, it may be necessary that the vaccine be administered at the same time as another vaccine. Based on provincial and territorial projections, there will be sufficient supply of the Moderna Spikevax vaccine for children 6 months to 5 years of age. The government is working closely with the provincial and territorial partners and understands they will be rolling out vaccination programs for children in this age group. Please check your provincial, territorial, or local health authority website for information on when the vaccine will be available in your area. Beginning a primary series now will offer protection to these young children. It's also the right time to remind everyone to keep their vaccinations up to date and to get boosters, those boosters that are recommended to them. With this authorization, and NACI recommendations will come as a relief to many parents of young children. Some may still have questions about vaccination. Parents and caregivers should speak with a trusted healthcare provider if they have questions.